Well, good morning, Waterbury. Thank you so much for joining us this morning to discuss the critical importance of providing COVID-19 vaccinations for our pre-K to 12 school staff and teachers and professional child care workers. Since the start of the pandemic, the governor and I and our Department of Public Health and our Department of Education have been committed to reopening our schools safely while protecting the health of our educators, teachers, administrators, staff, and students. Throughout COVID-19, we've seen our teachers step up in so many ways and go the extra mile to ensure students continue to receive a top-notch education, whether they were learning in the classroom or from home. So as our state continues to move forward with its goal of reopening our schools as safely as possible, it's critical that we get to our teachers and education support staff their vaccinations. Waterbury has been an incredible partner throughout this pandemic. It took all of us working together, our offices, the municipalities, community leaders, to keep our communities safe. And over the past few months, the city of Waterbury has been working tirelessly to get shots into people's arms. They've built a very robust vaccination infrastructure that uses community outreach as a way to ensure that its diverse population gets vaccinated. And since we announced that teachers and those ages 55 to 64 can begin scheduling appointments on March 1st, Mayor O'Leary, the city's public health department, and St. Mary's Hospital have been working to develop and implement a new, unique model that will ensure that our teachers get vaccinated. And so, here to tell us more about the work that Waterbury is doing and is on the cutting edge and leading the way as always, your great Mayor, Neil O'Leary.
Thank you. Wow, what a great crowd. Nice to see all of you here today. I apologize for the smoke. There's a huge fire about a mile north of here, and so that's the result of all this smoke that we're breathing in. I'm going to make my words very brief. Of course, we're honored, as always, to have Governor Lamont here with us, and our Lieutenant Governor and I were together this morning at a ribbon cutting at the Mattituck Museum, and thrilled that she could join us here as well. All of our elected officials here, our school superintendent as well. So, listen, this is really simple. We need to get our children back in school. And we all know that, and we're really honored to have our teachers here with us today, and we're very, very pleased. I know these decisions that the governor has made during this pandemic have required enormous amount of courage, and honestly, there are very few decisions that he's made during this pandemic that have been easy, and we know that. And this decision now to open up the vaccination age appropriate has, as always, impacted many people, particularly our school teachers, our paraprofessionals, our custodial staff, everyone in education. It's allowing our teachers the opportunity to get the vaccinations, which will make them all obviously more comfortable in returning back to work. And that's so, so vitally important. We know in-person education is paramount. We know this, and you all know that. You're the experts. Truth of the matter is, some folks have, expressed some disappointment in the fact that they might have to wait a little bit longer. Fact is, 96% of all the people who have passed away from this horrible COVID-19 have been 55 or older. Important point, right? So I think as difficult as the decisions have been, these are the appropriate decisions. In fact, especially for our children and getting them back to school. This pandemic has impacted them in many, many different ways, as we are all very well aware, and it's time to get these children back to school as soon as possible. So I'm grateful. And there's one shout out I have to make here, and I'm glad there are so many people here to hear it. There's a gentleman here by the name of Adam Renko. Adam is our emergency management director. Since mid-January, he has coordinated our efforts in meetings and organizing for this COVID-19 pandemic. He's worked, and I mean this when I tell you this, 24 hours a day, 7 days a week, since the middle of January with our staff over at St. Mary's Hospital and Waterbury Hospital. He's around every Saturday, every Sunday since then. It's been almost a year now, as you all know, and this guy deserves a big round of applause. Adam, thank you. As the Lieutenant Governor points out, we're ready. So we are, starting tomorrow morning, we will have a hotline for teachers and school staff. You'll call that hotline and you'll get your appointment for your vaccination. And over at our mass vaccination site at WAMS, Waterbury Arts Magnet School, Governor and Lieutenant Governor have been there. We will have a section just for the teachers and the custodial staff, administrators, and so on. So we're going to get you done very, very quickly. So, we're very excited to get you in, get you your shots, schedule your second shot. Let's go. And the hotline will be distributed to all of you via email, and probably we'll do follow-up with a voice-activated phone call to all of you as well. So thank you all for being here. Thank you especially to our teachers for their commitment to our students, our administrators, and of course our Governor and Lieutenant Governor. Thank you.
Mayor, thank you so much for highlighting that in our state we lost 96% of our COVID-19 victims were over 55. And it's also important to point out that in our over 55 population, we will be capturing 75% of the people that have pre-existing conditions and comorbidities. So I just wanted to add that to the mayor's great point. And now it's my pleasure to introduce the superintendent of the Waterbury Public Schools, Dr. Ruffin. Dr. Ruffin, thank you for joining us.
Thank you, Lieutenant Governor, and thank you, Governor, for being here today. We are very excited about the vaccines that will be administered to our teachers and to our educators so that they can provide and continue to provide what we know is the best education for our students, and that's in-person learning. We are excited because on many fronts. We're excited because we have a mayor that's proactive in assuring that we deliver on promises that are made here in Waterbury. We have the facilities and the staff and the commitment to see to it that it is actually going to get done, not just talked about. And we have an additional excitement. We meet weekly, sometimes more often, to discuss the reopening of schools more fully in person that we plan on doing in March, and had a meeting as recently as yesterday about what that schedule will look like. So now, instead of talking about being able to vaccinate our teachers and our educators, we can actually say that's going to be part of the plan. And I think it brings a level of comfort to our people. It brings a level of commitment that we work jointly to make certain that we do care and that we're going to be able to open schools for our students. We see our most vulnerable students in elementary schools that really need to see their teacher and be able to learn phonics and learn reading and learn reading skills that are essential and that cannot always be done effectively electronically or with our virtual learning. So while we are deeply appreciative of the opportunity for virtual, we are so excited that now the plan for reopening schools becomes real in Waterbury. So we thank you for that, and we thank all of you for being here today. And the plan and the committees that meet involve our union members, so we're excited that we have representative of our staff here that can work on a robust plan for returning our students, and now we can say with the proper vaccines for our staff. Thank you so much.
Thank you,
And now it's my pleasure to introduce WTA President Kevin Egan, who has brought with him members of the teaching staff and support staff. Kevin, thank you so much for joining us.
Thank you, Lieutenant Governor. Good morning, all, and what a great day and beautiful day to be here. First, let me extend a heartfelt thanks to the Governor, Superintendent, all of our dignitaries, the Mayor, State Rep Reyes, State Rep Napoli, who is one of our own teachers. Thanks so much for all being here. But make no mistake about it, this is a huge win for both teachers and students alike here in the city of Waterbury. Vaccines have been a #1 priority for us, and because as you all know, although this pandemic has forced us to all learn new ways of teaching and learning, there is no and will never be a replacement for in-school, in-person, live instruction. And this proposal from the governor will now produce less sickness, less quarantine, less stress, and ultimately more teachers in front of our students. If I could speak to every single Waterbury parent right now, face to face, I would tell them that together, with all of us up here, and our 1,600 WTA teachers will now be armed and ready to be back in full force in the classrooms to do what they do best, and that is to educate your child. On behalf of the WTA, thank you all, and have a wonderful day.
Kevin, thank you so much, and let's have a round of applause for Waterbury's finest, our teachers and support folks. Raise your hands. All right, and now it's my great pleasure to introduce State Representative Jerry Reyes for a few words.
Thank you, Lieutenant Governor. Good morning, everybody. Geraldo Reyes, 75th District State Representative, and it's my honor and privilege to be here representing the Waterbury delegation and the many supporters of first responders, essential workers, educators, all getting vaccinated. It is no secret that I've been advocating for many, many different populations of folks to get vaccinated. Deep in our hearts, we know that we want everybody to get vaccinated, and there's going to be a pecking order. And we may agree and not agree, but there's no disagreement when it comes to our educators and our essential workers. We need to get our kids back to school. I'm a father, I'm a grandfather. My grandkids need to get back to school. I'm too tired to keep watching them. This is a great day for the city of Waterbury, the state of Connecticut. This is a step in the right direction, Governor. Thank you for your leadership, Mayor, Lieutenant Governor, and all dignitaries here. This is a step in the right direction. Thank you.
Representative Reyes, thank you so much. Now, also representing the city of Waterbury and a teacher himself, Representative Ron Napoli Jr.
Good morning. Thank you, Lieutenant Governor, and thank you all for being here. This pandemic has been very, very challenging for teachers. Teachers love what they do. I'm a Waterbury teacher, and I see how hard my colleagues work every day. They go into their buildings, and they want to make a difference. And, Governor, you gave them the opportunity to do that, and we thank you very much.
There you go. All right. I like that.
Thank you so much, Representative Napoli. And now it's my pleasure to introduce Dr. Stephen Schneider of St. Mary's Hospital. Dr. Schneider.
Thank you, Lieutenant Governor, and it's a pleasure to be here. I want to say again how wonderful a partner Mayor O'Leary and his team have been working with St. Mary's Hospital for this city. I think the relationship that we have is unique in the state of Connecticut in terms of the hospital and the city partnering so closely together. Using both of our resources combined has really led to a vaccine center that I would compare to any in the state. To you teachers out there, I want to thank you so much for everything you do every day. Our emergency department has been almost overrun with children suffering all kinds of anxiety, stress, things that probably 4 times as many as before the pandemic started and the schools were closed. that is how much these kids depend on you every day. You are heroes for what you do, and really, we appreciate it. Lastly, I just want to say that I've said this before once to Governor Lamont, and I truly believe it, so I'm going to say it again, that your decisions, the courage that you've shown in making the decisions, you have truly saved thousands of lives in this state, and we will owe you forever for that. Thank you.
Dr. Schneider, I think that is the quote of the day, and a perfect way to introduce our very courageous leader, Governor Ned Lamont.
Well, Steve, thank you, and Ron and Jerry. I'm trying to keep people healthy, so when you put on a coat, aren't you getting chilly out here? And Jerry, you reminded me, we need more vaccines. I'll just cut to the chase, because we don't have enough vaccines for everybody. We're trying to prioritize how we can do this, maximizing public health and safety and keep our kids in school safely. And Jerry, you reminded me as a grandfather and saying, I want my kids getting back to school. And I was talking to the teachers, right? We just talked about this 5 minutes ago. And you said a lot of our kids don't yet feel comfortable going to school because they worry about going home, and maybe they have a grandmother or grandfather and they worry about the possibility of infection. So this is how we thought about getting these vaccines out. That's why we said 75 and above were the overwhelming majority of the fatalities taking place. 65 and above, same thing. And maybe now, 65 and above, those kids know, Jerry, your grandkids know that they can now go to school, they can go to school safely, that their grandparents soon to be vaccinated. You guys 65 and above, you got 3 more days. 3 more days before those 55-year-olds start coming into the mix. So take advantage of it. We have a lot of new vaccines being arriving at CVS and Walgreens, our pharmacies. There are additional appointments available now, through next week, and take advantage because, on Monday, here come those 55-year-olds. And the other reason we wanted to do this, Mayor O'Leary wanted to do it here in Waterbury, is because Waterbury keeps taking the initiative. You and I talked a few weeks ago. We worried that our underserved populations, brown and black, were less likely to get vaccinated than their white counterparts. And we wanted to do everything we could to bring the vaccine to people in need and make sure they could do it. And that's when we went to the school, didn't we? And what it did. That's when we went back to the school and tried to make a difference and make sure that everybody could get vaccinated, and what a difference you have been able to make there. And what this means for our schools is so important. I'll tell you what this means for our schools. It means we're educating, it means we're able to vaccinate the teachers, the janitors, the food service workers, those that take you to school, the paraeducators, everybody who is part of the school ecosystem, so you know that you can be in school safely, your kids know that they can go to school safely, we can keep our schools open, and we're just getting started. We got a fair amount of dough from the federal government. Teachers, I was asking you, put on your creative hats right now. We got money. I want to make sure these kids not only are going back to school this spring, but think about the summer programs we're going to have available to them. Maybe not all sitting behind a computer. They got to get out. They got to see their friends. They've got to learn experientially, but get them back into the groove going forward. So in September, we got everybody vaccinated. Our schools are going, and our kids are ready to go. And there is good news. I mean, we started out when it came to vaccines, we were getting about 46,000 first doses a week. Now we're up to 100,000 doses a week. And next week we get our first 30,000 doses from Johnson & Johnson, J&J. So help is on the way. We have in place the structure to help everybody get vaccinated, make it easy. Neil gave you the phone number. You can always go online, 211. We have extra people able to answer the phone. Take advantage. I got to tell you, spring is coming. Spring is in the air. vaccines are going to make this be something in our rearview mirror very soon. And teachers, I can't wait to see you in the classroom and those classrooms filled with kids again. Thanks, everybody.
Excellent. Thanks, Gov, and we thank all of our media partners for being here. You are essential. And with that, we'll open it up for questions, and any of our distinguished folks can speak.
I had a question for the governor. We had someone contact us. They're a teacher in Massachusetts, but they live here in Connecticut. What should they do? Wait for 55, vaccinate in that state?
Say that again. It's a teacher who lives in Connecticut, but
Works in Massachusetts.
if you're 55 and over, you get vaccinated here in your state of Connecticut.
Okay, and does this include just child care workers or anyone? How about nannies or babysitters?
No, this is for the child care workers. I should have made a big emphasis upon that as well. We're doing everything we can for the child care workers. They showed up every day during the peak of the pandemic. And by the way, a lot of grandparents are child care workers as well. They take care of their grandchildren. So it's very important they've been vaccinated, able to take care.
Governor, will you have enough? When are you going to have enough vaccines to do these clinics for these teachers? Because the DPA sent out a memo the other day that said, or an advisory to providers that said they don't expect this to happen to the second half of March. So, is it a possibility that this could bleed into April?
I don't think so, Paul. I think we're going to get the vast majority. Everybody will have their first vaccine done in March. Look, I don't totally control the supply. That comes from Washington, D.C. But as I just told you, the supply has been going up, not going down. It's coming on a regular basis. Waterbury is great. They're the first school system to say we're ready to go, ready to get those vaccines going. So they're going to have that special line for teachers and everybody else who works at school. And we're going to be rolling this out at school districts across the state.
What about the state's ability to handle these additional appointments? We've been hearing constant stream of complaints from people ages 65 to 74, before that, 75 and older, about trying to get appointments. Is this situation going to be improved going forward? What are you doing to make it better?
Not doing what they did in the other states where they said everybody first come, first serve, everybody's essential, everybody's got comorbidities. And then they had to wait in line for hours, the websites crashed, people waited in lines for hours and hours and days in Florida, and then there was nothing at the end of the line. We're doing this by appointment only. We've got a clear set of people. They know who they are. They know when they can get vaccinated. And like I said, Paul, we have slots open right now for people 65 and above. Sorry, you're too young.
Governor, what's the expectation for getting students back in school full time? In places like Ohio, they've used the vaccines as sort of a bargaining chip to say, hey, let's get you back in school. I think they actually linked it exactly to that.
Well, I'd like to ask the superintendent or maybe Ron on that, but I will tell you, Hartford has announced they're moving back to a 5-day-a-week schooling. They'll be doing the cleaning in the evenings a little more. I think we have a variety of other schools are already full-time or going back to 5 days a week. Any thoughts here in Waterbury?
Yes, our plans are, as we're meeting in committee and we're meeting regularly, is to be able to open back. You know, we are still currently open 5 days a week. Our plan, of course, is in hybrid, and our intention is to return with more students in school, in person, and we're working on what that schedule is going to look like, so it could be a longer school day with students in person and how we can accommodate all the learning needs. So that plan is in the works. It is not finalized, but it will happen in March at some point as soon as we can finalize it and have everybody at the table knowing that this is the best practice for Waterbury. But our plan is to get students in school in March, more in person.
So it sounds like, Governor, you want to sort of do what you've done on the other school reopening and closing plans, to sort of rely on locals to do the right thing and get more kids back in school, but nothing mandatory.
That's correct.
And Governor, when it comes to the J&J vaccine, those doses that we're going to receive next week, was that incorporated into the timeline that you released on Monday, or is that in addition to what you'd already expected?
We had anticipated that we were going to be getting J&J vaccines sometime, in March. I didn't know we were going to be getting it this fast, and I didn't know we were going to be getting 30,000. So this is all positive news in terms of how fast we can get people
vaccinated.
And that vaccine is a little bit less effective than the Pfizer or Moderna. So do you have a plan for how you're going to roll that into the rest of the allocation? Like, will people have a choice? Like, how is that going to work?
No, I disagree with that question. The J&J vaccine, as well as Moderna and Pfizer, are extraordinarily effective. J&J vaccine has prevented all fatalities, all real complications. It's a single-dose vaccine, unlike the other two. So I think you should be very confident with any of these vaccines that they will get the job done for you safely and effectively.
Superintendent Ruffin.
No, don't brand shop. We got enough complications in this process. They'll tell you the vaccine you're getting, and all I can tell you is they're all safe and highly effective.
Governor, mechanics of this, is this just public school students, or teachers and educators, or is it also private schools?
All.
All. And then also, are teachers and educators able to get it at any clinic, or just these specialized sites that you're...
It's up to each of the superintendents. We're going to work, every school district's going to do it their own way.
Superintendent Ruffin, will teachers, after they have received both shots of the vaccine, be required to return to the classroom and teach?
I do not believe that is a prerequisite to returning back in school, and we have many of our teachers that are back in school now. It's just that we have very few students back that we want to return more students in.
But will you require teachers to return to the classroom after they've been vaccinated?
Will I require them? I'm encouraging everybody to be there, and we're reviewing every case that may ask for an exemption, but yes, I want all of the teachers back into the classroom.
So there'll be a process where somebody says, well, I don't think it's safe enough for me to go back to the classroom. Here are the reasons why. You review it, and you say, okay, we agree with those reasons, so yes, you'll be exempt.
Absolutely,
No,
we do that currently. We have a review process for everyone that asks. But the intention is to return everybody back safely, and we believe that we have a plan to do that now.
Have you surveyed teachers to see what share of them actually do plan to get vaccinated?
We did. We took surveys before to ask if and when it becomes available, how many of our staff would be willing to take the vaccine. Overwhelmingly, the majority said that they would want the vaccine.
Do you have a percentage?
I could not quote that percentage to you right now, but I'm certain I can get it for you.
Mr. Egan, would you like to answer the question about whether or not...
Last I heard, it's close to 90% of teachers want it.
And what's your thoughts on whether or not teachers should be required to return to the classroom after being vaccinated?
So I would agree with the superintendent. The WTA has been very involved with every case for every teacher that has asked for those kinds of exemptions, and I don't expect that process to change. Obviously, everyone is in a different situation, in a different spot, and the superintendent has been very consistent with reviewing each case separately. Thank you.
Governor, had you thought about including the supermarket workers and folks with other comorbidities in with the teachers group, since I guess under your original plan they were part of that same group to be vaccinated?
The CDC had an original plan that included a whole variety of workers and a whole variety of it included about 2/3 of the adult population of the state of Connecticut. So it was not a prioritization plan at all. What we've got right now with teachers and underserved populations in 55 and above, I think addresses those who are most in need, those who are most at risk, and if the vaccinations keep coming, within 3 weeks it'll be 45 years and above.
Yeah, I think the mayor said 75% of all people over 55. Is that
Go
right?
ahead, Susan.
Yeah, it's estimated that 75 that people over 55 will account for 75% of the population with comorbidities and health issues. So if we keep going as the governor has planned, we're going to take care of 75% of our population that has those health issues.
And Governor, have you heard from other states, because I guess it's just you and Gina in Rhode Island right now.
I've heard from a lot of other states.
Yeah.
I mean, it's just so friggin' complicated for these other states. You're essential, you're not essential. Type 1 diabetes, not type 2 diabetes. They sort of like the way that this takes care of those people most in need. 75%, but 55 and above is 97%, as the mayor said, of fatalities. That tells you we're taking care of the riskiest population and also keeping them out of hospitals, which maintains our capacity going forward. We're having a lot of interest, yeah.
Apparently, Disability Rights Connecticut has filed a complaint with the Civil Rights Office about the change up in the structure that they do. Can you respond to that?
I've been informed about that. I think they filed something down in Washington, D.C., but their real frustration ought to be with the CDC and the list of comorbidities that are on there and aren't on there. I mean, folks with intellectual and physical disabilities weren't even listed on the CDC list. It was really surprising.
Off-topic question. Tomorrow the legislature can have a public hearing in public health about a bill that will allow terminal patients to take doctor-prescribed medicine to end their lives. I wonder if you have a position on that.
I haven't. Let me follow up on that bill and get back to you if I could.
Governor, do you know if other schools...
No, I just had understood that in the debate when you were running for governor, you did have a position.
Yeah, I think I'm sympathetic not having the government step in, but let me see what the bill's all about. I'm not sure there.
Lieutenant Governor, you mentioned that the comorbidities for people in the age groups. Could you just flesh that out a little bit? What age group was it?
So it's for,
There you go.
yeah. So 75% of the people who have comorbidities and health issues are people in the 55 and older age group. So you will, if you vaccinate 55 and up, you will be covering 75% of the population who has comorbidity issues and health issues.
And so is that the comorbidities that CDC defined, or what do you define as?
Yes, and I think that statistic is from the CDC.
Will others, do you guys know if other school districts will be setting up a hotline like Waterbury or not? Was that something?
Yeah, no, good going. You guys move fast. We've heard from a number of school districts who are trying to get going next week as well, which I'm really happy about.
So there's others going to be doing this hotline thing, or do you know how they're going to do it?
Well, every superintendent, every school district does it their own way, but I think Waterbury has it right.
Governor, who are the players as far as getting these teachers and the teachers to be vaccinated? We're talking about local health districts. Are there any other entities that are going to play into this? We really talk to the superintendents, how they get that done. But who are the players here that are going to help get this
Yeah.
vaccinated?
Deirdre and Public Health are working with the local public health departments in each and every one of the communities, and then the superintendents are reaching out as well, and we put together a plan for each and every one of these areas.
And how large is this population that you're hoping to get vaccinated? The teaching community in general, teachers, staff, faculty,
Yeah, do you know that number? I don't have that off the top of my head.
Waterbury.
Total number of folks in the teacher community, is that
In
200,000?
Waterbury alone, it'll be almost 4,000, believe it or not. 1,600 teachers, then we have the paras, then we have the administrators, then we have the custodial staff, and then we have all the tutor. So it's about 4,000. And, again, as the governor has pointed out consistently from the beginning, we have 500 vaccines right now dedicated to our education personnel, but that's just right now. So we'll get there. We may not get there as quick as we'd like to because we're actually ready to go 24/7. We really are. We just don't have the vaccines. So we have the infrastructure in place. And, I just feel it's important to talk about, just for a second. I actually sit on the allocation subcommittee for all of this, and we've had a lot of discussions, obviously, about comorbidities and those disabled and so on and so forth. And not for 1 second has the governor or any of us involved in this process forgotten about any of those people. But this system seems to make the most sense for where we are right now. Having said that, clearly the governor, the lieutenant governor, and our commissioner of health has made it very, very clear over and over again, as soon as the quantity comes, we will touch those populations, and they need to know that we have not forgotten about them, nor will we.
Mr. Mayor, do you have any idea how long it will take, approximately, to vaccinate some 4,000 people? Maybe Mr. Schneider can help as well.
If we had the vaccines in hand, we could do it in 4 or 5 days, easily. Probably less, because there's another mass vaccination site across town at Post University, partnered with Waterbury Hospital. They're prepared, equipped, and staffed to go 24/7 as well.
Superintendent, could you talk a little bit about vaccinations are just one thing that might fit people back into school. I guess I'm curious if there's other barriers in place. The CDC guidelines, for example, they recommend 6 feet apart for students. They also recommended upgraded HVAC systems. Are those still going to be barriers for your district to get more students in school?
Absolutely. There are several considerations that we've had since the pandemic in reopening schools, and we have been able to successfully implement those from the beginning when we opened in September. And so I do have several members of my staff. I have my chief operating officer as well as others who have worked consistently and tirelessly. I'm sure they're tired, but they act like they're tireless. And they're working with everyone involved, the Department of Health as well as the crisis management team, with the protocols for keeping schools safe. That's the PPEs, that's the cleaning of the schools, that's the regularity of cleaning the schools, the ventilation, and everything else that's so important. The hand washing and the hand washing stations that we've now invested in, and the more that we're going to invest in the future, to make certain that we're not only asking people to wash their hands, we're making it available for students and staff to do so more regularly. All of those things have been considered and continue to be considered as we reopen schools more fully.
Governor, there's about 130 people who got overpaid in unemployment during the pandemic. Those folks, some of them have their situations rectified, but there's a good chunk that are now getting their 1099s to file for their income tax, and it's appearing that they owe more tax on money that they gave back to the state because they were trying to do the right thing. Is there a remedy here? Is DRS working on a remedy?
Yeah, Jody, I guarantee you there'll be a remedy. They're not going to pay tax on money that they didn't receive or shouldn't receive. The only good news is there were 7 million fraudulent unemployment claims in California, and you mentioned we had 130. So I'll tell you, DOL did a very good job, as best they could, in these tough circumstances.
People are saying that they can't get through them, that the website is not being very intuitive, that they're not getting phone calls back, that they're panicking because they have to go to their accountant.
They should give their legislator a call or they could call the Lieutenant Governor's office and we'll help them. We have a liaison to the Department of Labor.
Governor, is there any
That's good
new,
advice.
Information on the any additional cases of the South African and UK variants of the coronavirus detected in Connecticut?
Not in Connecticut, and our rate continues to be low. It was 2.1% yesterday. But we are looking in New York City right now, and there is a highly infectious variant that I don't think anybody's quite been able to define. There's another one in San Francisco. So the bad news is there are a number of these variants that are circulating around. The good news is the mRNA vaccine. We can come up with booster shots that can address those variants very effectively and pretty quickly.
Well, at the beginning of this pandemic, you pointed out that New York sneezes, Connecticut catches a cold. So how concerning is it that this new strain is in New York City, especially since we still have people?
I don't love the fact that it's highly infectious. I love the fact that vaccines work against it. We're getting more vaccines. Our schools are getting vaccinated. Older folks are getting vaccinated. Younger folks are getting vaccinated. That's how we'll be able to prevent these different variants as they come along. Hey, thank you, everybody. Love Waterbury.
Thank you. Governor, do you have any COVID numbers for us today?
Hospitalizations are down a bit, 2.1% positivity.
Thank you.
Governor, can you say how the teachers are going to get the vaccination, like special clinic and individual schools, school district offices?
Yeah, we can do that. So as the governor pointed out, every district is doing they may be doing their things a little bit differently. As I mentioned before, here in Waterbury, we have a special hotline just for education staff, teachers, administrators, and others. You'll call the hotline, you'll get your appointment, and we'll get you in, and that will run. As long as we have the vaccines, that will run 24/7 until everyone's vaccinated.
Governor, one more question. Last week you mentioned that the travel rules will be relaxed. Where are we on that?
Still having conversations with our neighboring states. We ought to have something on that by first thing next week.
Do you know what it will look like, possibly?
No, not yet. Thanks, everybody.
Thank you all.